Since 2006, Needham has participated in the MetroWest Adolescent Health Survey. It is conducted every 2 years by the MetroWest Health Foundation to support communities in prioritizing and enhancing local programming and policies related to adolescent health and well-being. Here's Derek Reisner on what the findings of the 2023 report revealed about Needham students.
On Tuesday, February 25th, the Substance Prevention Alliance of Needham, also known as SPAN, and Youth and Family Services presented highlights from the 2023 MetroWest survey to the Needham Select Board. The survey showed that overall in 2023, most substance use trends in Needham have stayed the same or decreased since 2021.
We had seen a bit of a decrease. We weren't sure if we could trust it because of the pandemic. I think there were a lot of things that could have interfered with the data, just not going to school, not seeing other students. But especially for marijuana and electronic vapor products, we're seeing a continuing decrease, and we're also seeing increased perception of harm.
Most substance use rates for Needham High School students is on par with the average use rates for all towns included in the MetroWest survey. However, one exception is alcohol use, which is 8 percentage points higher for Needham students than for the MetroWest average.
We know from the MetroWest survey that our high school students report accessing alcohol from a variety of places. We see that data on the left side of the screen. So, for example, accessing alcohol either at a party or from a friend not at a party are the two most popular access points that students tell us. But nonetheless, alcohol compliance work prevents underage access from our local businesses, and we have a couple of images there from a previous PowerPoint about our RBS, our Responsible Beverage Service training, and compliance checks where we have underage operatives go into all of the businesses and try to make a purchase or request the service of an alcoholic beverage. So that's been, I think, a very powerful factor in our community partnerships and trying to work to reduce access.
But SPAN has also taken action to address substance use rates across all areas.
So most students believe that their peers are using substances at greater rates than what is actually reported. And this misperception can actually shape attitudes favorably towards substance use and can have a normalizing effect among young people. So SPAN created 5 messages using a positive community norms strategy to let students and families in the community know that most Needham High School students do not use substances. We made vinyl banners with these messages that we put out in public places around the community last year. Some of them are still up. So the effect of these over time is that it will correct these misperceptions and eventually, hopefully, see a decrease or contribute to a decrease in use among our youth.
The survey also provides data on mental health. Among high school students, school is the most commonly reported source of stress at 71%. Also, female students are significantly more likely to report mental health issues than their male student counterparts, a trend that has been noted for several years. Mental health data comparing high school with middle school students also revealed some unusual trends.
If you look at the graph on the right showing middle school versus high school, another thing I just thought was worthy of highlighting was the fact that middle schoolers are reporting suicidality at higher rates than high school students. And again, we don't capture qualitative data to understand, why this is or who these students are.
Have we ever seen that before?
I don't think that traditionally we have. Yeah, I think traditionally they've been fairly similar, but high schoolers have been higher than middle schoolers, I think, in the past. Again, I think that there are some changes that may have happened recently in youth with the pandemic and just the mental health crisis that we're experiencing right now that may have changed the pattern. Just a quick note that in some of these slides, we talk about a decrease. Again, we like to see a decrease. A decrease is great, but 2021 to 2023, I just want to note that 2021 we saw a really sharp increase in poor mental health patterns and poor mental health indicators. And so we're happy to see a decrease, but I think it's just an important reminder that the decrease really brings us back to sort of this high baseline that we were at before, or even sort of slightly higher rates than we were at previously, despite seeing a decrease from 2021.
Director of Youth and Family Services Sarah Shine overviewed the many programs and workshops they have that address mental health issues in Needham. However, eliminating barriers for access is also an important point of concern.
That's, I think, one thing that happened during the pandemic is people weren't able to access services when they needed to. People were isolated and people weren't able to access services. So what we've tried to do is change our services a little so that we can get people in our doors quicker. We had a humongous wait list during the pandemic, which we still do, but we've changed our format a little bit. So if somebody's calling us, we're trying to get them in within a week so that we can at least meet with the family, connect with the family, connect them to other services if we can't take them. And we're trying to kind of create this bigger family, this bigger community change to really make a bigger impact on the mental health crisis that we're currently in.
The MetroWest survey is available for viewing on the SPAN Needham website. Just go to spanneedham.org/surveys. For Needham Channel News, I'm Derek Reisner.